Morning all. As Boris Johnson prepares to set out his roadmap for easing coronavirus restrictions next week, new data suggests the lockdown is helping to cut infection rates in England. But also this morning, there is a warning that nightclubs, bars and music venues could face extinction unless urgent action is taken. MPs say more than a third of workers in the nighttime economy have lost their jobs since the start of the pandemic. Let's take you through a few of the key points of the day. One of the largest coronavirus surveys has found that infections are falling in England, suggesting that lockdown is working. Imperial College London's React survey found that cases are now at a similar level to where they were in September. Meanwhile, Sky News has seen internal Whitehall documents indicating that a reopening of the economy in the weeks after pupils return to classrooms on the 8th of March, with hospitality venues potentially opening by the end of April. Still, all this as a cross-party group of MPs warns that nightclubs, bars, music venues, they all face being wiped out unless urgent action is taken. Sky's Emma Birchley has our first report.
For most of the past year, this music venue in East London has remained empty when it would usually look like this. But with COVID thriving in crowded spaces, opening up hasn't been an option. It's left the owner of the Oval space wondering how his industry can survive.
You need to be cautious but not super cautious, because if you're super cautious, you'll kill us. We've been shut for a year now. If we're not open sometime in the summer, if we have to go into the autumn, then a lot of businesses, I think, will fail.
Now a report by a cross-party group of more than 40 MPs has echoed that warning, predicting the nighttime economy faces extinction without urgent government action.
We need some more support, some grants and some business rates relief extension and a furlough extension, and the things that are going to keep these venues going until they're able to open fully. But we also need a clear roadmap for when they're going to be able to open fully.
The report reveals that nightclubs, bars, pubs and music venues, plus their suppliers, have made more than a third of their workforce redundant. In clubs alone, the figure is over 50%. Earlier this week, the Prime Minister described nightclubs and theatres as the toughest nuts to crack when it comes to finding a route to reopening. He dismissed the idea of vaccine passports, but suggested that rapid testing might provide a solution. This time last year, Jeremy Joseph's nightclub Heaven was hosting the Pussycat Dolls. With crowds this big, he can't see how such testing could work, but he says something needs to be done.
To be honest, when you talk about financial support from the government, it's not really worth talking about. I mean, we're not getting the monies that we need. For example, rent for our 4 venues comes to £409,000 a quarter, so the government give you £3,000 a month. That ain't going to touch the sides.
The government says clubs can continue to access a package of support worth over £280 billion, and a plan for how businesses can reopen will be outlined on Monday. But with income from the UK's nightlife estimated to contribute £66 billion to the UK economy, there's an awful lot at stake. Emma Birchley, Sky News.
I'm pleased to say we're joined once again on the programme by the Care Minister, Helen Whately. Ms Whately, good to have you on as always. And of course, loads to talk about on your brief specifically. But before we do, I think we just need to reflect that which we were hearing about the hospitality sector. Businesses in the nighttime economy have on average made almost 40% of their staff redundant. What support is going to be available to the nighttime sector when the economy does eventually reopen?
I mean, it's clearly absolutely true to say that hospitality sector and the nighttime sector has been so hard hit by the pandemic and by the restrictions. I mean, what we know is already there's been a package of £280 billion worth of support to the economy from the Chancellor, from the government. And as of next week on Monday, the Prime Minister is going to be setting out the plan for how we come out of lockdown. So to me, that's a really important thing for us to be step by step and doing this cautiously, of course, because we want this to be the last ever national lockdown, but step by step for us to be taking forwards, coming out of these restrictions, firstly getting children back to school, but in due course, opening up hospitality and getting back to life more like normal.
I suppose part of the problem has been, of course, the government having finite resources and determining where they were to go. Before the vaccine rollout started, it was very difficult to see how the nighttime economies could get back to anything approaching normality. I mean, you appeared on the show back at the tail end of September and said the following: it doesn't make sense to continue supporting jobs where there simply isn't work at the moment. Was that, though, perhaps an oversight, given the fact that we have seen almost 4 in 10 workers in that sector losing their jobs?
Well, as I said, I think the important thing is that in the weeks and months ahead, we take the steps to come out of lockdown, to move on from the restrictions that we've had to have over the last months, most of the last year. We're in a much, much better place now. We've had nearly 16 million people vaccinated. That's a huge deal. We have an enormous testing capacity as well. We've learned a huge amount about the virus. We've got better treatments for it as well. So I see us being in a much better place as we come through this. But we will, of course, hear more from the Prime Minister on Monday.
Yeah, a huge deal and indeed a huge achievement, of course. The route out of all of this, though, is of course where the focus is, and specifics will come on Monday. I understand that. But as you said, we will want this to be the last national lockdown. The signal from central government has been that we want to be relaxing things on a national basis. Some suggestion, though, in the papers this morning that if there were to be an outbreak, we could see a return to localised lockdown conditions. What's your view on that?
Well, I'd say probably wait until next week, until when the Prime Minister sets out that roadmap for how we're going to come through it. But we have clearly learned a huge amount. We learned during the summer about how to manage localised outbreaks and take that approach. But I don't really want to preempt what we're going to hear next week.
Sure, I thought that might well be the response. Well, let's talk about schools, are we? Of course, March the 8th, big date for many people, not least the parents in all of this. And again, we know that testing in schools is going to be part of the way we move out of all of this. But we're now being told that we could be seeing teachers in secondary schools administering one set of tests and then the responsibility being put onto the parents, at least for secondary school students.
Well, first, let me say, I, like many thousands of parents, am really looking forward to when schools go back. I've got 3 children at home, homeschooling, and I think, as all of us know who are doing that, it's not the easy thing to do, and gives you even more respect than you already had for the teachers who usually teach your children, and in fact have been doing an amazing job providing online support during the pandemic. So we're looking forward. The plan is for schools to be able to start going back on the 8th of March. And again, next week more will be set out about how the return to school is going to work.
I understand that, but one thing we can say with certainty is, from that REACT study that's out at the moment, clearly some of the greatest transmission that is taking place, or the highest amount of transmission that's taking place is taking place in children. It is taking place in younger people. Now, that may well be a result of the fact that they're not in school, that they're associating at home. But does that not give any pause for concern? Does that not give any pause ahead of the decision to reopen schools on March 8th?
Well, what has been clear is that we will look at the data, and the reason why we have put off saying what the roadmap's going to be until next week was to make sure that we had time to look at the data, to know that we have vaccinated so many people, to be able to look at the impact of the national lockdown on rates, to also see how that has enabled hospitals to be in a better position to cope. And there's one reason why a level of caution is being counselled, to recognise the lockdown we're going to come out of it step by step, because we still have over 20,000 people in hospital with COVID. We still had over 1,000 new admissions on Saturday, for example. So this isn't over yet, though we have this fantastic situation we're in of nearly 16 million people vaccinated, the vaccination programme going at such a tremendous pace, and there's a brilliant job being done by the NHS and by volunteers, some of whom I've met, who are supporting the vaccine programme. But we are going to have to take this step by step. But what we've always said is we're determined to bring back schools as quickly as we can, because we know that being out of school is not the good thing for children's education. It's so much better for children to be in school, and that's really important that we try and get that to happen.
Tell us a little bit, Minister, about the additional funding that's going to be made available for looking at long COVID. I mean, clearly it is a condition of concern for all of us, but particularly, of course, for those people who've been working on the front line and have contracted COVID through, doing their job and looking after the rest of us.
Oh, you're absolutely right. And I mean, what we were seeing is about 1 in 10 people suffering from some form of long COVID. So having some symptoms that go on for 3 months or more, quite a range of symptoms. But some are really making a really tough to live with. And so we need to understand more about this illness and how long COVID affects people, and also how to sort of treat people and support people. That's one reason why today we're announcing £18 million more going into research into long COVID, and exactly that, how we can help support people and treat people and help people through it.
And part of the reason, Minister, of course, that I mentioned those working on the front line. Some really interesting data out today about people applying to become nurses. Nursing applications are in fact up by a third. I've got to say, slightly surprising to me that in the middle of a viral pandemic, people are wanting to go out there and help. But actually, perhaps it's not desperately surprising. The British public rallying together.
Well, I think you put it exactly right there, and I'm really glad that you've brought this up, that we're seeing from the UCAS figures out today that we've had a third increase of applications to study nursing degrees. So we've had nearly 50,000 people apply to study nursing already to start this autumn, which is tremendous news for me with oversight of the NHS workforce. It's a really big deal because I want us to make sure we have more nurses, that we have the workforce that we need, and we have 50,000 more nurses coming to the NHS by the end of this Parliament. So this is really important for the NHS. But exactly as you say, it's a real reflection on how people have seen the fantastic job that the NHS and actually social care workers have done throughout this pandemic, and want to step up and join them, and have got that sense of public service. It's really, really good news and a real testament to how our health and social care system has been coping in this pandemic.
Yeah, I mean, of course, another sector, and one that you're directly responsible for, that we need to see more people going into, is, of course, the care professions. I mean, we learned yesterday, and I know this will be frustrating to you, but we learned yesterday that the social care plan, that Boris Johnson promised back when he became Prime Minister in July 2019, has again somewhat been kicked into the long grass. No action being taken on that, as I understand it, until at least the end of the year. Can you just provide some reassurance to those who have family members in care homes, who are perhaps working in social care themselves, that we are actually going to start doing this at some point? Because, the party has been in power since 2010, and we have had a number of promises on social care. Everyone understands pandemics get in the way of things, but it does feel like, once again, social care is not where it should be.
I mean, absolutely. And I remember it was roughly a year ago that the Prime Minister asked me to take on the job of being Care Minister. And then the job was very much going to be driving forward our ambitions for social care reform. Then we've had the pandemic, and inevitably we've had to focus all our resources and attention on helping social care through this really, really difficult time. But we are absolutely determined that we're going to take forward social care reform. There is work going on this. We're going to come out with our plan during the course of this year. We've seen absolutely that the social care system needs it. It's been really tough for social care to get through this pandemic. And so I'm determined that coming through this, we will get to a better place for social care and make sure we get to a care system that everybody knows is going to be there for them and give them the care that they need. And also, as part of that, make sure that we really give the social care workforce the recognition and the support that they deserve for the really tough job, but actually really rewarding job that they are doing too.
Well, look, people are waiting for that, and they're eagerly waiting for that, and they have been eagerly waiting for quite some time. But just one last question on care homes. 95%, I think that was at the end of January, about 95% of care home residents had their first vaccine. What is the earliest possible moment that people will be able to go and see their relatives in care homes?
I really, really want to open up visiting in care homes more. I mean, to be clear, we have made sure that visiting can continue even during this national lockdown, but I recognise it's not the normal kind of visiting. It's having to use screens or visiting pods or through windows if care homes don't have those facilities. I will say we have put funding into social care to help care homes have these facilities and have extra staff if they need to supervise. But what I want to do as we come out of the national lockdown is also increase the amount of visiting. I don't see that we have to wait for the second vaccination dose. I want us to open up sooner than that. But I will say with this, as with generally as we come out of lockdown, we do have to be cautious. Most residents in care homes have only had their first dose, and some of them only very recently. So it will be step by step. But I'm determined, so that we can see people, go back to even if it's to be able to hold hands again, and to see somebody who you haven't been able to see very much in the last few months and over last year. I really want to make that happen again.
Minister, I know we've got to let you go, but just for clarity, when you say second dose, do you mean second dose for all of us or second dose for care home residents?
I meant for care home residents.
Great. Thank you. Minister, great to have you on the programme.
Thank you.
I want to speak to our political correspondent, Kate McCann, listening to that interview. What leapt out to you, actually, just that little bit of information that we had from the Minister at the end does provide, some indication that actually there could be more normalised visiting within care homes relatively soon, actually.
Yeah, I totally agree with you. I think at the end there, that could mean that people could visit care homes within weeks, because remember, most, as you say, care home residents, well, they've all been offered it. Most have taken it up. There are still some who haven't been able to because of outbreaks in actual care homes. But if Helen Whately is saying we don't need to wait for second jabs, actually, I think that things are safe as they are, then that could mean that families could start to be able to see those people that they've been separated from for so long within weeks, if the Prime Minister lifts the lockdown restrictions we are all living under, of course, because some people won't be able to travel beyond where they live if their relatives are in a care home further away. So still we'll have to wait and see what happens on Monday. There were some sort of interesting suggestions on social care. That's such a big issue. The Prime Minister made those pledges on it when he was elected, as you said. And at the time, that was one of the most controversial aspects of the election, because the promise was that people wouldn't have to sell their homes for their care. Now we know the economic situation is vastly different to how it was then. It was already expensive. It will be even more so now. A little indication we'll see something by the end of the year, but what that will be, I mean, if it's another commission, another joint political commission, that will be disappointing for people.
Certainly will. Kate, many thanks indeed. Still to come on the programme this morning, I'm going to be discussing the future of clubbing and the nighttime economy with the DJ, Fat Tony. He's going to be here at 8:05. Time for a different vision. Sir Keir Starmer delivering his thoughts on what should be in next month's budget. We'll be hearing from the Shadow Chancellor just after 7:30. And at 8:50, we're going to be joined by a mum of 3 who's been separated from her husband for almost a year because of coronavirus restrictions. To the United States now, and as authorities decide how to reopen schools there is evidence that closures are taking a toll on students' well-being. They're seeing an increase in demand for counselling sessions, as one expert warns of a growing mental health crisis. Our US correspondent Greg Milam has the detail.
Well, I often tell the story that when I met a new acquaintance many years ago and they asked about my family, I said, Dylan's going to have a great life. He's smart, he's athletic, he's good looking, and he has lots of friends. He'll be able to do whatever he wants.
It was barely a month ago that Dylan Buckner took his own life. His family says school closures due to the pandemic played a part.
450,000 people and counting in the US have died of COVID. And that's a terrible thing. But I'm fortunate in that I don't know any of those people, but I do know one person who committed suicide. There really is no doubt in my mind that the lockdowns, the isolation, the lack of in-person schooling, the lack of in-person interaction with his friends, the lack of football absolutely contributed to his death.
And Dylan's family isn't alone. Across America, the debate over whether it's safe to reopen schools now can't avoid what experts say is a mental health crisis. A rising number of suicides in some places, cries for help everywhere. Fewer than half of students have returned to this high school in suburban Chicago. There is a quiet, an emptiness here. In these rooms, there are virtual counselling sessions, and the demand has increased.
For the students that struggled, we started to see students that started to really show up with signs of depression differently than they had before. Everything from not being able to take care of themselves to just not getting out of bed, doing school from their bed, and then not engaging in the class at all.
As schools everywhere work to reduce the COVID risk, even a full return to class could come too late for some.
He was awesome, and I know moms say that about their kids, because every mom thinks their kid's awesome, but I'm not the only one that thought he was awesome.
Being away from school changed Trevor Till.
I saw some of his light go out a little bit. It made him sad. It made him angry. You know, he kind of felt lost.
Trevor took his own life in October. His family saw no warning signs. His mother says the isolation, too much for him.
I think that the kids, they need other kids. They need to be involved. They need to be in a classroom with their teachers. You know, you're missing all that interpersonal stuff that's very important. I think there's going to be a lot of PTSD from this. You know, there is going to be, and as a country, we're not equipped to handle, you know, mental problems or mental challenges at all.
It's really important to talk to your kids, you know, really talk to them. But it's also important, too, that friends talk to friends. I mean, the reality of it is Dylan, as much as we loved him, and I think he loved us, and I think we were good parents and had a very strong family relationship, you know, just couldn't open up to us about his struggles in the same way he could to his friends.
I don't want anyone to have to go through this. It is the worst. It is the absolute worst.
The reasons for any suicide, of course, are complex, and there are no easy answers. But there are families who believe their loss is just one more awful, hidden cost of this pandemic. Greg Milam, Sky News, Chicago.
And if you're in any way concerned about your mental health, you can always email the Samaritans on jo@samaritans.org, or you can call the number on screen right now, 116 123. Now, the Duke of Edinburgh has spent a second night in hospital as a precautionary measure after feeling unwell. Prince Philip will be spending a few days in the private King Edward VII Hospital on the advice of his doctors. Let's speak to Sky's Lorna Bundock, who's outside the hospital in central London. Morning, Laura. I think a lot of people have been mightily reassured by that use of the words precautionary.
Absolutely. The Duke has now spent his second night here in hospital. He was brought here on Tuesday evening by a car, said to have walked in, and I think the tone of the statement from Buckingham Palace was really significant, explaining that he was brought here on the advice of his doctor for some rest, for some observation, expected to be here for a few days. But it was the use of those two words, the fact that this admission was a precautionary measure. It did seem to lessen the sense of alarm about this. Also, the fact that the Queen has stayed in Windsor. She's not in London. She was in Windsor yesterday, carrying on with her royal duties. It's where the couple have spent most of the pandemic. We know they received their COVID vaccines there last month also. We don't really tend to get many details about royal illnesses, but interestingly, this time we do know that the Duke's admission is not related to COVID. It is, of course, though, a worry. He's 99 years old, due to celebrate his 100th birthday later on this year, but I think the indications are good. It wasn't an emergency admission, and he's said to be in good spirits, and that's how he seemed last year. Of course, we don't see as much of him these days since he retired from public life, but certainly the outings, the photos we've seen, he does seem to be in good spirits. He was last admitted to hospital back in December 2019. He spent 4 days here then, and no doubt he'll be hoping this time it's an equally short stay and that he'll be back home before too long.
Laura, many thanks. Now, let's have a couple of the other stories making the news this morning. Facebook has announced it has blocked users in Australia from viewing and sharing news on its platform because of a proposed law in the country. The legislation would see digital giants paying news companies for their journalism. The restrictions now also mean that international users outside Australia cannot see or share news from Australian outlets on Facebook. Almost 2 million people were unemployed or fully furloughed in January and had been for at least 6 months. The Resolution Foundation has suggested keeping the job retention scheme in place for several months, in fact, after public health restrictions are lifted. As we were discussing with the Care Minister, a record number of students have applied to study nursing at university during the pandemic, according to new UCAS figures. There was a 34% increase in applications to undergraduate nursing courses in England since last year. Absolutely love this one. After 7 months travelling through space, NASA's Mars Perseverance rover is to make its final descent onto the red planet later. and will begin to search for traces of life. The mission, backed by the UK government, is to collect samples for future analysis from across Mars. Emergency services are investigating after a house collapsed following a suspected explosion in Bury. Homes had to be evacuated overnight and power supplies were cut to dozens of others, as Milena Veselinovic reports.
Emergency services were called to this street in Bury last night after an explosion tore through this house in the middle of a terrace. Residents nearby said they heard a huge bang just before 9:30.
There was just this huge noise. It sounded like, honestly, like a bomb had been dropped in the middle of the street. I expected to look out the window and just like see a crater or something. It was unbelievable. I've never heard anything like it.
Police told residents to lock up their houses and evacuate to a nearby garden centre. Northwest Ambulance Service said that 2 people were taken to hospital. Neither are thought to be seriously injured. This morning, several homes remained without electricity as emergency services continue to investigate the cause of the incident. Milena Veselinovic, Sky News.
Let's return now to Handforth in Cheshire, where parish councillors have been meeting for the first time since their, well, somewhat unruly Zoom bust-up went viral. This time around, the public were invited, but it appears calls for respect and calm went somewhat unheard.
I was trying to be helpful.
George, shut up.
Agreed.
Yeah, shut up, George.
Can I just say, please, let's respect each other.
In Texas, thousands of sea turtles have been rescued after being stunned by the unusually cold weather. The animals become somewhat lethargic in cold water and have been washing up on shore. More than 3,500 turtles, in fact, have been temporarily rehomed in a convention centre. But those plunging temperatures mean volunteers are unsure when the creatures will be able to return to the ocean. Time to see how the weather is looking on this side of the Atlantic. Jo standing by. How's it looking, Jo?
It's looking rather unsettled, it has to be said. Fairly wet and windy for us this week, which makes a change from the wintry conditions, of course. But as we go into the weekend, we've got a big storm system coming in. It's already been named by the Spanish as Storm Karim. It's going to give some very heavy rain for them, and no mean rainfall totals for us either. Let's take a look.
Look forward to brighter skies. The weather, sponsored by Qatar Airways.
Hello, good morning to you. Yes, it's all rather unsettled at the moment. Here's one area of rain making its way across the country, and here's the next one that's making its way in for the weekend. And this one's going to rather get stuck over western parts and get pulses of rain running along it. So that's where our high rainfall totals are going to come from. This morning, it's fairly chilly across parts of Ireland, milder across the UK mainland. The rain, though, pushing its way eastwards through the course of the morning. We'll see the day's highest temperatures ahead of that rain belt. So around 10 or 11 this morning, we'll see temperatures of 10 or 11, and then things will cool down a little bit through the afternoon as we see sunny spells and scattered showers starting to come in. Cold again tonight early on, becoming milder later as this cloud, rain and strong winds work their way into western parts.
The weather, sponsored by Qatar Airways.
Finally going to...
Jo, thank you. Still to come on the programme this morning, we'll be reporting from Texas, where a huge winter storm has killed more than 20 people and left millions without electricity.
I want to thank the people that are adhering to the restrictions, and I think it's just been really hard because I am a mum. I do have a family at home, and I do have 2 children who are homeschooling. I have an 18-year-old who is waiting to get into university, who isn't having the help that she requires from school in respect of there's no direct help. I've got a 14-year-old child who is at home, who is doing really well on the homeschooling. However, it isn't at school and does have his own anxieties about leaving the house. My husband works from home full time whilst trying to carry out his role as a husband working from home. He's also continuing to help with homeschooling. And I think from a working female's point of view, as well as being a mum, I am coming to work. I have worked all the way through COVID, and I am expected to be out front facing on the streets, making sure that people are safe. And I think it's about the anxieties around that and the expectations that you're to go out there and do your job, which we do, you know, no problem. However, you do take that anxiety home.
Welcome back. Just a little more on our top story now. And as Boris Johnson prepares to set out his roadmap for easing coronavirus restrictions next week, new data suggests that the lockdown is helping to cut infection rates in England. A little earlier, I asked the Care Minister Helen Whately when people could expect to be able to visit their loved ones in care homes in person. She said visiting may be opened up before residents receive their second vaccine dose.
What I want to do as we come out of the national lockdown is also increase the amount of visiting. I don't see that we have to wait for the second vaccination dose. I want us to open up sooner than that. But I will say with this, as with generally as we come out of lockdown, we do have to be cautious. So most residents in care homes have only had their first dose and some of them only very recently. So it will be step by step.
Just for clarity, when you say second dose, do you mean second dose for all of us or second dose for care home residents?
I meant for care home residents.
Now, Sir Keir Starmer is expected to accuse the government of offering only a roadmap to yesterday in its post-pandemic response. In a speech broadcast online later today, the Labour leader is set to label the upcoming budget as a fork in the road. The Shadow Chancellor, Anneliese Dodds, joins us now on the programme. Ms Dodds, always good to have you on. Let's talk about the budget. And, of course, we're waiting to hear from Sir Keir just a little bit later on today. But it strikes me that what essentially the Labour Party is saying is, look, there are opportunities being presented to us as we emerge from this period of COVID-19.
Well, there are opportunities that we can't afford not to seize because of the impact of this period, particularly on our economy. So the UK has had the worst economic crisis of any major economy during this crisis. That means we must do all we can to particularly build the jobs of the future, to give businesses more confidence, to ensure that our economy does start growing again. And Keir will be setting out later a number of the ways that the Chancellor needs to be planning for the future. You know, I would say, unfortunately, the Chancellor hasn't even taken the decisions he should have taken yesterday around things like continuing the business rates holiday, for example. But he also, as well as those urgent decisions, does need to be planning for the future, especially around those additional jobs that are so desperately needed.
One of the more traditional dividing lines between the Conservative and Labour parties has obviously been the amount of public sector spending. I wonder if some of the attack lines from the opposition side of the chamber on budget day are somewhat minimised by the huge amounts of money that this government has been spending, even on business.
Well, the big question is whether those huge amounts have been spent in order to protect jobs and secure businesses for the future. And unfortunately, during this crisis, we've seen eye-watering amounts of money being wasted and mismanaged. And we've urged government repeatedly to get a grip on this, get a grip on those contracts that aren't delivering, but also make sure that spending is really targeted. You know, when we've been calling for a continuation of that holiday in business rates for companies that really need it, we've said to the Conservative government, please learn from Labour-run Wales, for example. In Wales, they said that support should be targeted at the smaller companies, so they didn't provide it to the very biggest essential retailers, many of which have actually seen their turnover increase massively during this crisis. So it's not just about the amount of money at all. It really is about whether it's directed where it's needed, whether it's supporting jobs and businesses. And it has not been doing enough in that regard over the last few months.
Shall we talk about the nighttime industries then, just for a second? And of course, I don't know about you, but my clubbing days are largely behind me. But I'd still like the opportunity at some point to go out and enjoy a night that doesn't end at 6 p.m. I mean, in terms of the nighttime sectors, we have this all-party group warning today that they could be at risk of extinction. I mean, the government really has ignored the nighttime sectors up until now.
Well, I do think they have. I should say, I do hope your clubbing days aren't completely over. I would say that actually, you know, in the UK, and very often this is forgotten, actually our performing arts, our creative industries are an incredibly important part of our economy, very important for our exports as well as domestically. And they're under incredible pressure now. And repeatedly we said to government, please, again, look to the future, consider the role of these economies for the future in our recovery. We've said to government they need to be clear now around those issues like business rates, but they also need to be clear that for those sectors, like the nighttime economy, but there's a number of other areas as well, where there will be pressure for a number more months, government needs to be clear that there will be that wage support targeted and now delivering training as well. If they provided more certainty, then I think we would be in a different situation to where we are now, where we've seen record redundancies, unfortunately, and where we're seeing many business owners throwing in the towel because they just cannot see that future for their business. That's bad for all of us, not just bad for them.
Sorry to interrupt. We're just about out of time, but wasn't the government correct to focus on parts of the economy that stood any chance of opening? I mean, it was pretty obvious from quite early on last year that, you know, people were not going to be associating in live music venues, were not going to be going out clubbing in the way in which they had done in 2019.
Well, I would say that we've actually had a very stop-start approach to support throughout this crisis. I mean, decisions around the continuation of the furlough scheme, for example, last year were taken with only 5 hours left to go, and that has been linked to an increase in unemployment in the UK at a time when it was stabilising in other countries. So really, we've not seen that application from government across the board to provide certainty around jobs for the future. That is what we need. We need also to have a vision around the new jobs that we will need to see for the UK. And that's why Keir is calling for that vision later on today in his speech.
Anneliese Dodds, good to have you on the show this morning. Thanks for being with us. Now, Texas, you may have heard, experiencing some of its coldest temperatures in 3 decades. In some parts of the state, it has been as low as -18 degrees Celsius, and at least 21 deaths have been blamed on the winter storm. High demand for electricity has also caused the power grid to fail. More than 4 million people are currently without electricity. Our correspondent Adam Parsons reports.
For Alex, this must feel like the perfect storm. Heavy snow, no water, no electricity, and his wife due to give birth at any moment.
I think she's maybe instinctively kind of holding back on having the baby just so we can maybe have power and water and roads can be a little bit clearer to get out. But yeah, definitely unnerving as we've gotten closer to the due date.
He has stocked up, the habits of the past 12 months now reaping a dividend.
It's a lot kind of like what we've just gone through with the pandemic. You know, you're kind of without services, you're without places to go. So to a certain extent, we're a little used to it.
Supermarket shelves here are emptying. Delivery lorries can't get through. People in this, the richest country in the world, facing sudden, brutal hardship.
We're nervous because people are starting to lose power again. You know, right now I'm just worried about, does my son have enough food? You know, I mean.
And does he?
Kind of. So, I mean, I've been trying to find stuff, but it's kind of hard.
This state has little experience of really Arctic conditions, and it is struggling to cope. Well, this community's had a series of power cuts, which is why they've hired their own generators to help them cope. They've also been without water for a couple of days, and even when it comes back on, we've just seen a pipe bursting. Now, it is hard to prepare for a once-in-a-generation event like this, but there is also anger that more wasn't done to plan ahead. And also that when they look at downtown Dallas, the banking headquarters and skyscrapers simply don't seem to be affected by the problems that they're having to deal with here. It is that stark difference, the feeling that the rich elite are somehow insulated from pain, that infuriates many.
Obviously, they're going to have electricity down there because of hospitals. That's smart. You know, we have to, you know, that's where they need it the most. I get that. But, you know, those big companies and all their big lights, that's just screams, you know, I don't give a crap is what that screams.
Texas has had days to sort this out, but it is still in a state of chaos. There's warmer weather on the way, and for many, it just can't come soon enough. Adam Parsons, Sky News, Avondale in Texas.
Still to come on the programme, the call for better investment in youth services after new research finds funding has been cut by almost 3/4.
I'm Neville Lazarus and I'm Sky's reporter based in Delhi. We aim to be the best and most trusted place for news.
I'm Stuart Ramsey and I'm Sky's chief correspondent.
An enormous explosion has just come down. I think it was a monster that's just landed in between us. We saw snatch squads going in, grabbing people and putting them into trucks.
You either live and recover or you die.
Okay, so that's like a war.
That's the war, yes.
Yeah. We help you understand the world with us.
For the past 24 hours, the soldiers have been attacked on a number of occasions. It's really sending a clear message that Venezuela is eager for change. We've been crushed.
We take you to the heart of stories that shape our world.
They were convinced the United States would become hooked. Well, they were right.
We hear shotguns being fired and also tear gas is being put around.
The information on this could bring down the entire network, not just in Iraq and Syria, but across the world.
It's not out of control, but they've withdrawn. It's so hot.
For the early risers.
As we examine the story beyond the headline.
For the knowledge seekers.
Welcome to Divided States.
For the straight talkers. The curious and the ones who want to be entertained.
Backstage, Sky News' entertainment podcast.
For wherever you are.
Welcome to Sophie Ridge on Sunday podcast.
For the ones who want to know more.
Welcome to the All Out Politics podcast.
For the listeners.
From Sky News Storycast.
Sky News Podcasts. Listen and subscribe for free.
Welcome back. The YMCA says the future of thousands of anxious, isolated and vulnerable young people would be at risk if more funding isn't reinvested into youth services across the UK. Sky's Sadia Chowdhury reports.
It was a programme aimed at empowering girls that turned Macy from a teenager with anxiety to her new confident self. The 17-year-old says she's an example of why youth centres and their workers are so important.
Even during the lockdown, the YMCA and the British Red Cross have given me so many opportunities where it's took my mind off not being able to concentrate at school, or the fact that I didn't know what my GCSEs were going to be, or starting into my A-levels.
The sort of help Macy had access to is on the decline because many child services across the country simply can't afford to stay open. The YMCA says local authority spending on youth services in England fell last year by 6%. It says that means funding for youth services has been cut by 73% over the last decade.
If you think about a local community that's had facilities and programs in place for young people to engage with, and then suddenly overnight they just disappear, where do young people go then? They go on the streets, and we wonder why there are problems with crime and disorder in local communities.
Hello, boys, how are you doing?
In Manchester, it's here on the streets that vital youth work takes place. Manchester Young Lives CEO is Paul Fletcher, who says that without the workers, a young person could get drawn into a gang within a matter of days.
They look to belong somewhere, and that alternative subculture is the dangerous place for them to go to, but unfortunately too many of them gravitate towards those activities.
A government spokesperson said, "We recognise the vital role youth services play and are providing dedicated support to help them manage the impact of the pandemic on young people. We have provided more than £250 million of dedicated support for youth organisations, building on the £11 billion given to local authorities this year, who have a statutory duty to allocate funding to youth services in line with local needs." Youth services are calling on the government to help change the course of the future for thousands of anxious and isolated young people, amid warnings that without adequate reinvestment in youth services, we could be creating a lonely, lost generation with nowhere to turn. Sadia Chowdhury, Sky News in Manchester.
Any way you look at it, testing is central to the way in which we will be coming out of lockdown, be it mass testing for asymptomatic carriers, whether it is testing in schools or indeed whether it is test and trace. And there are some arguing that local authorities should now be administering that part of our response. Let's speak now to the chair of Bolton NHS Foundation Trust, Professor Donna Hall. Professor Hall, great to have you on the programme this morning. I wonder if we might start with test and trace. And clearly, if we are to avoid clusters turning into widespread community infection as we start to see lockdown restricting, it has to play a big part. I suppose the question is it better to be administered at a local or a national level?
I think definitely at a local level. We've seen the different impacts on communities of coronavirus and how it impacts differently in more deprived communities. It comes up in little spikes every now and again in workplaces, in schools, in local GP practices and around those areas. But what we've got at the moment is two parallel systems. We've got a national system and a local system, still not properly speaking to each other. So, for example, if you're a teacher in a school and you have symptoms, you'll go and get tested, and it'll be the national system that tests you and then deals with all your contacts. If there's an outbreak in a local school, it's local authorities and local GP practices that have to respond at a local level. So you've got a completely crazy system that just doesn't connect around the individual and the family. A few months ago, we saw that people were being contacted 20, 30 times a day in the same family by the national contact testing system. It really does need to come down to a local level, have one properly resourced system. We've seen the beauty of the vaccine rollout that's been done at the local level, using GP practices, the local NHS, using local authorities, public health teams, and the army as well, really resourcing that. And we've seen how amazing that's been by just having one system that works properly at the local level. It's really confusing for people. Local authorities are really in despair. You've seen the resource constraints in the last item on youth services. where over the last 10 years, local authority budgets have been almost halved in terms of funding cuts. So we need the resources. Public health teams have been set up to do this. This is their job. And we're going to be living with this virus for at least the next 18 months to 2 years. So to continue to fund a £22 billion private sector initiative is just not sustainable.
I mean, the key word there is resources, though, surely. As things stand, local authorities, the local groups that would be administering this need an awful lot in terms of infrastructure, money and so on if they were to be able to carry this out.
Absolutely, but they've really stepped up, Neil, despite the resource constraints that they have. And this is what the NHS does incredibly well with local authority colleagues. We just get stuck in. So 60% of contacts that have been traced have been through the local system. So why not just give all the resources, the 22 billion that we've given to private sector companies, let's give it to public services. We've seen that they can do it. Let's believe in them and invest in them, and we'll make sure we get through this virus.
I mean, Professor, just some news that has reached us in the past couple of days, of course, is the use of the lateral flow tests, some mass surge testing. Do you have any concerns about that? I mean, the false negatives that have been reported in terms of lateral flow are certainly significant.
Yes, we're finding that lots of the false negatives that are coming forward. It's very, very concerning. It's not about the numbers of tests, and this seems to be an obsession about numbers of tests. It's actually about the effectiveness of the tests, the efficacy of the vaccine, and how we're all working together to stop these continued outbreaks. As the virus mutates, this is not going to go away. So we need to have a really robust, very, very connected, integrated system at the local level. And, you know, the lateral flow test, it's just an example. We found out the other day that some Asda stores within the country are going to be getting these tests, not all of them, but some of them. But the local authority in that area didn't know about it. So it's kind of two different bits of the system that are not speaking to each other. And, you know, we've seen that when there are outbreaks in workplaces, for example, the meat factories that you did report on, it was local government that got stuck in there, that closed down the factories. 20,000 people a day are not self-isolating. That's where local government comes in to support them, to help them, to knock on the doors, to provide housing support, to provide welfare support, food parcels, and to support them through the self-isolation process. It's got to be an integrated system, and at the moment it isn't.
Professor Donna Hall, Chair of Bolton NHS Foundation Trust. Great to have you on this morning. Thanks for being with us.
Thanks, Neil. Thank you very much.
Time for us to see how the weather is looking. Joe is at the wall.
Look forward to brighter skies. The weather, sponsored by Qatar Airways.
Hello there, good morning to you. It's looking a little bit wet over the next few days, but as it's fairly mild, it should be warm rain at least, which is some consolation. However, there will be quite a lot of it. This system coming in, Storm Kalim, is going to give some significant rainfall over western parts of the country, perhaps 100, 150 millimetres, which may lead to some localised flooding. We've got further rain today. It's currently over western parts. It'll be pushing its way eastwards through the day, and we'll see sunshine and showers following on those showers, most concentrated up towards the north and the west, particularly over western parts of Scotland. It is going to be windy everywhere, with gales around western coasts and temperatures at best around 10 or 11 degrees Celsius, 52 Fahrenheit.
The weather, sponsored by Qatar Airways.